A patient is rushed to the emergency room after noticing throbbing pain, swelling, redness, and warmth in the leg and arm, sudden breathlessness, sharp chest pain, and coughing up blood. Upon arrival, the patient was declared to be dead. The family asked for a post-mortem examination or autopsy to know the cause of death of the said symptoms. The clinical pathologist gets ready by washing her hands and wearing the prescribed clothing inside the operating room. The doctor is examining first the directional terms of the patient. Here is the left and right side of the body. Superior, which is toward the head end. For example, the eyes is superior to the neck. Inferior is away from the head end or toward the low part. For example, the heart is inferior to the eyes. In anterior, also known as ventral, this is the front of the body. For example, the chest is interior to the oyster. In posterior, also known as dorsal, this is the back of the body. For example, the back is posterior to the chest. Medial, this is the midline of the body. For example, the chest is medial to the arm. Lateral is away from the midline of the body. For example, the arms are lateral to the heart. Proximal is close to the origin of the body part. For example, the thigh is proximal to the feet, while distal is farther from the origin of a body part or the point of its attachment. For example, the feet is distal to the thigh. Superficial is the body surface, which where we are looking now, which is the skin. And lastly, deep is away from the body structure, like bones of the patient. Second, they identified the regional terms of the patient. The body is placed in a supine position to allow anatomical structures to remain in natural neutral alignment. Under cephalic area, there is frontal, orbital, nasal, oral, mental. Here is the cervical. Under thoracic area are sternal, axillary, and pectoral. In the abdominal, here is the umbilical. Under pelvic is inguinal, or also known as groin. On the upper limb part, it consists of acromial, brachial, which is also known as arm, antecubital, anabrachial, which is also known as forearm, carpal, which is also known as wrist. Next is manus, which has digital. While in the lower limb, there are coxal, which is also known as hip, femoral, which is also known as thigh, patellar, crural, which is also known as leg, and fibular. And lastly, in the pedal part of the patient, it consists of the following: tarsal, which is also known as ankle, digital, and plantar. The practitioners turn the patient body into posterior position to examine its body parts. Under cephalic, here is the occipital, which is also known as back of the head. Here is the cervical. Under the dorsal part, here is the scapular, vertebral, lumbar, sacral, gluteal. Next, the doctors demonstrate the body planes of the patient. Here is the transverse plane, which is superior to inferior side. Next, frontal or coronal plane, which is interior to posterior side of the body. Lastly, sagittal or lateral plane, which is medial to lateral side of the body. Here is the abdominal part of the body, wherein she examined the 9 quadrants in the abdomen, which are the right hypochondriac, epigastric, left hypochondriac, right lumbar, umbilical, left lumbar, right iliac, hypogastric, and left iliac. She first removed the sac and the chest part of the body, and cut along the longitudinal plane using a mid-sagittal section from the superior portion of the sternal region down to the inferior most part of the abdominal region. The body is now open, and as we can see, the liver is very large compared to other organs, and it is superior to other parts of the digestive system like the intestines. Meanwhile, lateral to the intestines is the gizzard. The heart, which is slightly superior to the liver, is first examined. To fully reveal the heart, the pericardium or the fibrous sac is removed. The pathologist cut the heart using the frontal plane and saw that there is a massive blood clot in the heart. This is the course of the sad symptoms that the patient showed. To clearly see the other organs, especially in the digestive system of the patient, and to properly execute the autopsy, she removed the other organs of the patient. She first removed the liver, and attached to it is this green jelly-like organ, which is the gallbladder. Afterwards, she examined the spleen, which is a lymphoid organ close to the gizzard of the patient. Meanwhile, slightly inferior to the spleen is the gizzard, which was also removed because most of it blocks the intestines. As you can see, the gizzard is mostly made up of muscular walls for contraction and digestion. After all of this, the pathologist examined the colon of the patient to clearly see the possible rupture the attending was talking about. A transverse cut was first performed to see the cross-section. She also made a longitudinal section cut to visualize the stretch of its walls and locate the origin of infection. Finally, she made an oblique section cut to see the depth of the infection on the walls. The intestines were then removed from the inside. She concluded that the main cause of death of the patient is the huge amount of blood clot around and inside of the heart, which developed a heart attack.
Based on the autopsy done to Mr. Cardo Dalisay, I concluded the patient's cause of death was a massive blood clot in the heart, which resulted to a heart attack.
The body of the patient and the organs were disposed of properly. as well as the gloves used by the pathologist. Rest assured that all materials were also cleaned and disinfected after use.